when my parents were raising me, a whole village to raise a child. Now, if you hold a child, he's going to go home and tell the father, and the father will call you. Who are you? Me, in my own time. My mommy will not touch you. She will call my auntie, Imushi. That she's sending me over for the weekend. I know the implication. The one emotion will send our children to my own house. You all know the implication when they are exchanging us. It took a whole village to train a child then. But now, so even when I have those children in my clinic, I can't talk to them. Well, you know, they will go and probably wait for me on the road when I'm going on and beat the hell out of me. Chase me that my mouth can talk. That's it. So please, those of you that have them as roommates and all that, enlighten them. It's very important. So that ratio is very important to us, and it's important again with your age. If I expect you at 70 to have a fatty breast, and I'm seeing a fibroglandular breast, I'm worried because the chances of breast cancer is quite high. So those are the implications for us. That is what I want you to know, that what is inside your breast changes with your age, changes with number of children you have had, changes when you expose yourself to oral contraceptives. Okay? I hope I make sense. And then, like I said, it also changes with your menstrual cycle. So that's why if you tell me that you want to scan your breast or you want to do a mammography, I would rather see you when the hormones are not. That's why I will ask you, when was your last period? So I usually will see you within the 10 days of your period. You understand? So we call it the 10-day rule. It's very important. So don't say that this doctor doesn't want to work. He has told me to come back next month. It's not that. Because whatever I find when your breast, the hormones are playing, might not even be true representative of what is in your. Because your breast is waiting that you will get pregnant. So it's going abnormal itself, trying to proliferate everything. So seeing you, the best time to see you is when that breast is quiet. Except if you have stopped menstruating. Women who have gone post-menopausal have stopped menstruating. Those hormones are not there. We can see them at any time of the month. Okay? And of course, the breast also changes with your menopausal status. When you become post-menopausal, your breast is more fatty. Because the hormones are not there to play on your fibroglandular that should be changing every month. What is just usually there is fat. Some will have very little fibroglandular, some will not even have at all. So when we say you have A, B, C, or D breast, the A is on the fatty side, the D is on the fibroglandular side. So it is as the fibroglandular is increasing that you move from A to B to D. I hope you understand. So that next time you have an ultrasound report, for example, you can interpret it yourself. Okay, so I've talked about the implications of that. So I want to talk about the normal variants. Please, maybe the next 2 slides. So these normal variants are important because I've seen women have babies and brought the babies thinking that those babies were abnormal. Meanwhile, these babies were just having normal variations. These next 2 slides, I've jumped. Okay, yeah, then the next one. Yeah, so if you look at this breast, for example, I think I would rather want to start. If you look at this breast, for example, this person has one breast and there's nothing here. And it's not as if the person has had surgery. This person has just one breast. We call it amastia. No breast on one side. It doesn't make him abnormal. The other breast will function well. If it is Obudo Yibo now, they will go and do reconstruction, construct something there and put it there. So that when the person is dressed, you will know that there's no breast there. So I had a patient who had a daughter, and she only had one breast. And then she was panicking. And I said, look, well, it's a deviation from normal. But this child is normal. Don't let that child grow up thinking that she is abnormal. So that's one variation. Next slide. Another variation is, usually all of us have 2 breasts. But you can see this person, he has a smaller breast under the armpits. This one is very common. Very, very common. In fact, inside OAU there, I cannot count how many people I see them. Even in College of Health Sciences there, it's common. Meanwhile, very funny, when those kind of people, when they are lactating, when they are breastfeeding, even that one will also secrete milk. Yeah. So they are not abnormal. You can go to the hostel and you undress and you see somebody and say, hey, village people. It's not village people. Please, these are normal people Do not make them feel out of place. Next slide, please. Next slide. Okay, so if you look at this person, she has two breasts, right? Is that something different? There's no nipple. So there are two breasts, no nipple. Of course, Obodo Oyibo, they will reconstruct a nipple for her. But the truth of the matter is, this is the normal variation. So you can have two breasts and there's no nipple. Next slide. Now look at this person. This person has more than one nipple for one breast. So if you look at this person, on one single breast, you can see one nipple, you can see another nipple, right? If this person is breastfeeding, the two of them will be shooting. That's the truth. So if you look at this one here, this breast has its own nipple. Then there's this nipple just below the breast. Now, I have a patient who has nipples, about 6 of them, and it goes this way. So she has the normal one on the breast, and then she has about 5. And she doesn't like to undress. She didn't go to the boarding house because of that. Her parents didn't put her. In fact, when she was in university, they had to take her out of campus so that she doesn't live with them. She really feels abnormal. But the thing is that for us medically, those are normal variants. They are not disease states. Of course, these kind of people can go for reconstruction, but that's not a common thing here in our environment. Like I said, I know a lot of people in that OAU that have normal variations of breast. They are my patient, I see them often. Next slide. Okay, so that's where we are handling anatomy. So my next slide is on overview of breast cancer. So I'm going to just take us on the risk factors generally. Overview of breast cancer. Yeah, perfect. So, next slide. Okay, so outline is basically to know how common breast cancer is, the pattern of breast cancer in Nigeria, and the risk factors and all that. Next slide, please. Now, like I mentioned in my last lecture, next slide, breast cancer is the commonest cancer in women. In Nigeria and even all over the world. And it is also the commonest cause of death from cancer. So if they say that the cause of death in this person is cancer, the commonest cause of that is also breast cancer. So the morbidity is high, the mortality is high. Now, unfortunately for us in Nigeria, the incidence is increasing. It's just going higher. It has never dropped. And there are many factors for this. Next slide, please. So this is what it looks like in Nigeria. No. The slide before this, please. No. Before this. Okay, so for us in Nigeria, this is what it just keeps going. It just keeps hitting the roof. Unfortunately, next slide. The incidence is increasing. They are coming in late stage. When it is late to do something, when they have felt that tiny lump, they will not come. They will go and buy Chinese herbal tea. They will go to churches. That's the truth. Some pastors will lie to them. They will go to spiritual houses. Go everywhere. Before they come to the hospital, that has gone into the advanced stage. At that point, what am I God? What we do at that stage is, we call it palliative care. We only treat your symptoms. You have pain. You have headache. You have this. When we could salvage, it didn't come. So the presentation in Nigeria is pathetic. Incidence is rising. The stage of presentation is also increasing. And so we need to create awareness. And one of the places to create awareness is in gatherings. And the truth of the matter is, people always say, the highest number of people you find in church are women. That's the truth. Women are the spiritual, everything to God. Men, I have one business in Calabar. From Calabar, I'm in Abuja. A woman is doing business, but her home is always the center. She's doing it inside the house. We've seen them online. They're inside the house. Men, they are doing it on the road, on the street. That's different. Women are the higher population of people in the church. So the church is a good target to create awareness for women on breast cancer. So, next slide, please. So this is what we see here in Nigeria. You see them fungating or sweating, blood everywhere. In fact, by the time they are coming, they are smelling because there's wound everywhere. Sometimes I leave clinic, I can't even eat for 4 or 5 hours because the smell and stench of my patients is still in my brain. You understand? So we need to create awareness so that we don't get to this stage. Next slide, please. Now, the other pattern in Nigeria is we see the younger women. Most of my patients now are 33, 34. I've had a 22-year-old nursing student. I have them in their 30s. When I was in medical school, breast cancer was a disease of 60. But now, it has changed. Whether it's the civilization, or whether it's the kind of food we eat now, we are still studying so many factors, studying many things. But now we are seeing them at a younger age. The tumors are more aggressive. Some people will carry lump 2 years. But some people will have a lump today. In the next 2 months, the lump has piam. You'll be wondering, what kind of aggressive tumor is this? So the kind of tumors we are seeing now are aggressive tumors. They come out today, in another 1 month, men, they've gone everywhere. They've metastasized everywhere in your body. They've left the breast, they've gone into the chest, they've gone into the liver, they've gone into the armpits. The other thing is, of course, I said we have delayed presentation. Women are also coming late. But there's a problem with the presentation also. When they come, when the time they drop the bill, they run away. The default rate is high. Because by the time they are coming there, they need radiotherapy, they need this, that's gone, is advanced. They will be giving them bills of millions. They will run back. They would run back. And then the prognosis is poor. Once you are already in the advanced stage, of course, except God does a miracle, the 5-year survival rate is less than 25%. So 1 in 4 women will survive beyond 5 years if they are in the advanced stage. So that is why we need to create a lot of awareness for it. Next slide, please. We said they are aggressive. Now, for us on the research side, people are beginning to talk about the implications of this for research. So there are a lot of clinical research, lab works going on, trying to understand the biology of breast cancer in Nigerian patients. Most of what we read in the textbooks were done in Caucasians. How many breast cancer studies have really been done in Africa to talk about Nigeria? It's just now that things are even getting better. So most of these things don't necessarily transform from Oyibo to the black man. The genetics of an Oyibo woman is not necessarily the genetics of a black woman. So the clinical researchers, the laboratory researchers are also doing a lot. For example, when I was doing my MSc, I worked on breast cancer in animal rats, in Worcester rats. And what did I study? Bitter leaf. I studied bitter leaf, and I wanted to see the response of these animals with breast cancer to what bitter leaf, because that's an everyday vegetable. I'm sure that if you pick 10 houses, 8 of them will have bitter leaf in their compound. So we are beginning to say that, look, the chemotherapy that Oyibo is bringing is too expensive, and people cannot afford it. But we have a lot of phytochemicals around. All our herbalists, all the things they are doing, they will carry this, they lie. God has made those things natural. They are there, they are in your compound, they are beside you. Eat natural, eat good. Not the one that will say, today I want to eat shawarma. I buy Coke. That to them, the measure of affluence, kind of food you eat. That's the measure of affluence. So no. Eat from your garden. Eat greens. They have a lot of flavonoids, saponins, tannins that fight. They have these anti-cancer properties. So we have still not understood breast cancer in Nigeria very much. So people are doing a lot of research. And while we are doing that, if somebody says that, I did a study in the lab and I saw that they responded to bitter leaf, go and pluck it, cook it. Yeah, even excess, the only thing that you will purge, Abi, it's not like chemotherapy that you have toxicity, take overdose. The only thing that happens if you take too much medication that you will purge. And stay in your house today, you are stooling now. Stay there. Put out the stooling. Let the stooling stop. You go out again. So, one of the things, why I'm talking about this is that you also need to know what is happening around you. Some people are in school. They are not passing through school. It's school that is passing through them. They don't even know what is happening in the next room, in their hostel. Talk about what is happening in the next class. Them. Thank God it's social media time. A lot of things are there. Don't always read the bad news. Don't always read that, somebody snatched somebody's girlfriend. That's what you people are doing on the internet. Go and read health benefits of ginger. Go and read health benefits of bitter leaf. Practicalize it. Now, have you heard? They said Davido That's what is going on. So a lot of things are happening. While we are trying to understand breast cancer, please, whatever you see out there that has been scientifically proven and is natural, please build your immune system. That's it. When they were talking about stress management, I loved that talk. Sickness is a form of physical stress. That's the truth. You are healed. You have stress in your life. You have to be taking drugs. You have to see the doctor. You have an appointment for 8 o'clock. If you don't go to clinic on time, they will not remove your card. And meanwhile, they're going to do school runs. That's a form of stress. You're not even healthy. You can't take care of your children. I love what mommy said. After God. Self. It's not your husband, though. It's yourself. That husband, if anything happened to you today. I have a patient who had breast CA, and they said they were going to do mastectomy. They were going to cut the breast. The husband said, no, the reason why I married her is because of that breast. So he didn't allow us to cut the breast. So the woman was there, and the thing was, at some point she couldn't walk again. She was on wheelchair because it had gone to her bones. You know that this woman was not dead yet. One clinic she came, she was so sober, and I was wondering what happened. Her husband has gone to marry another woman. Meanwhile, he said that it's that breast that he likes, that we should not cut. In fact, I was hungry. He said, because of the breast that you married. Meanwhile, he has gone to marry someone else. So please, after God, is yourself. I repeat again, after God is yourself. So what are the risk factors for breast cancer? This is very important. Next slide. No. Before. The slides before, risk factors, yeah. This is very, very important because you need to do a risk assessment for yourself and know how to take care of your breast. It's left to you. You only come to the doctor when you think there's a problem, but you live with your breast every day. So the first thing is the fact that you're a female increases your risk of breast cancer. I've told you that men also have breast cancer, but the fact that God made you a woman has increased your chances of getting a breast cancer. The other thing is aging. As you go older, your chances will increase because there are many exposures to many things. Even going under the sun is some radiation. You understand? So as you go older, your chances increase. One other thing is genetic factors. Our genetic makeup differ. What is in your own genes are different from my own genes. But that is what has made me unique and my father's daughter because of the genes I inherited from my parents. What has made you unique are the genes you inherited from your parents. And when you have your own children, what will make your children unique are the genes they've inherited from you and their father. Now, there are some genes in the body that predispose you to having a breast cancer. We call them the BRCA1 and BRCA2 genes. In this country, we don't do genetic checks. In Obodo Oyibo, if you say, I want to screen for breast cancer, one of the things they will do is to screen you genetically to know whether you're even carrying that gene. Because once you carry that gene, your risk increases by almost 50%. So if you have two people, one has the gene, one doesn't have the gene. The one that has the gene just needs a little position and then fix him. Meanwhile, both of you are roommates, you are sleeping together, you are going to the same classroom, you are exposed to the same thing. But this person has something genetically that has increased our own risk of having a breast CA. So your genetic risk is there. Unfortunately, if you have an opportunity to go out, please, always, if you can do a genetic check, please do one. And then family history. Once a woman presents to me and says, I want to check my breast, the first thing I'll ask you is that, do you have anybody that's had a breast cancer in your family? Particularly if it's a first-degree relative. And who is a first-degree relative? Your mom, your sister, your child. Those are first-degree relatives. I'm worried. So if you tell me that, oh, your mom has had a breast cancer, I'm worried. I'm not going to undo you like an average woman. I'm going to, if an average woman is coming back to see me in 1 year, you will probably come back in 6 months. So when you come to me, when I'm asking this, you say, what's their problem? They like to ask questions. I need to do a risk assessment for you. I know because what I'm going to do for Auntie Jo, not what I would do for Sumi, for example. You understand? So these are the reasons why we ask for it. Once there's a family member who is a first-degree relative, who are the breast CA, your chances have increased. So you need to pay more special attention to yourself. Then, your number of children. Fortunately, African women, we can born children. Hey! I know people that have 9, 10, 12, 8. Unfortunately, this is our generation. I'm inclusive. I only have 2. The more the number of children, the more protected you are. Yeah. Yes. So the less the number of children, I'm part of them. I only have two. They'll say, economy is not smiling. Oh, we cannot born more than two again. God has said that you should be busy, resi. See what he was doing. Only koma busy, koma resi. He said, no, economy. The more the number of children, the more protected you are. So, yeah, that's protective for you. So, the less number of children, the higher your risk of a breast. Am I communicating? Am I talking? Okay. So, the other thing is, usually most of us have the age in which we started menstruating. The earlier that age, the higher your risk. And this is why. Because you've been exposed to those hormones earlier than necessary. So if you have someone that started menstruating at 9 years, compared to someone that started menstruating at 16, the risk for the one that started at 9 is actually quite higher compared to the one that started at 16. So if you come to me and I say, when did you start menstruating? You say, this doctor's zone is too much. Not too much. I'm doing a risk assessment for you. I hope you understand that. The other thing is late menopause. People that take a long time to stop menstruating. Entry menopause has also many factors. Some people in their house by 50, now you are finished. I know women that they are almost 70, we're still menstruating. So you remember that I said the earlier you start menstruating, it means that you have had earlier exposure. The longer you menstruate for too, you have had longer exposure. So your risk also increases. You understand? So you need to understand all this. And then the other thing is hormonal factors. I talked about oral contraceptives. All of them, they will say they are prevent. I don't want to get pregnant. Use non-hormone based contraception. Please. When you say, doctor, is there no other thing I can do? Because there are times that these OCPs are actually prescribed for some medical reasons. If it wasn't prescribed to you for a medical reason, sincerely, go and do an IUCD. Or probably use the barrier method. You understand? Stay away from hormones as much as possible. And then, diet. Diet is tied with obesity. The bigger you are, in fact, someone like me, I'm battling my weight. Why? Because this is always in my head that, hey, I'm overweight. Don't let me get obese. Obesity actually increases the chances. In fact, I have two candidates that are working on obesity and breast cancer, which I'm supervising right now. People have begun to link factors with obesity. And you know that also depends on the kind of diet you eat. A lot of people are eating, I want sardine and bread. That thing that they use to preserve the sardine inside tin food. Bread. I want to make moi and I want to put it's corned beef. Meanwhile, there's Titus fish in the market. You know, but you drink corned beef. Thin food, run away from them. They are stored with carcinogens. So eat healthy, eat grains. Most of these things have their carcinogens. So your diet goes a long way, which is also tied with obesity. And then the next thing is, which is not common in this part of the world, is smoking and alcohol. But with this, our new generation, they smoke and drink like it's order of the day. But typically in the African setting, these are not two common factors in the environment. Next slide. Next slide. So what are the symptoms? You have seen the risk factors. What are the things that you should be worried about if it happens in your breast? The first thing is you have a lump. Having a lump does not necessarily mean that it is cancer, but you need to be sure that it is not cancer, so you need to get checked. Having a lump is one of the signs of breast cancer, but there are other things that can give you a lump that are not cancer. Okay? The other thing is breast asymmetry. Asymmetry is unequalness. One breast is just suddenly bigger than the other. Or one part of this breast is suddenly, the color has changed compared to this. Once your two breasts don't look alike, that's an asymmetry. Your breast must look alike. So once there's something that is looking different in one breast, it's an asymmetry. Please shout for help. That's why I said shout for help. The other thing is skin oscillation dimpling. Some people, usually our nipples are pointed out. Usually. Some few people have flat nipples. But it's not normal for that nipple to go back inside. So when your nipple begins to dimple back inside, please shout for help. It's one of the signs and symptoms of breast CA. And then, when you have a lump in your armpit, that's what I tagged axillary lump. Some people, they will press their breast, nothing. I remember one patient of ours, her daughter had just died from breast cancer. And that was the first time I was seeing that pattern. Usually it would be the mother to die. This one, the daughter died, breast cancer. And mama, Arugbo, Kuja, she came to me. There's something like that. Let me feel anything. Because when we started examining her, I wouldn't have found that thing. But she presented with something. Not that the breast was fine. And then lo and behold, no. So these are things that when you see, you should please alert. The other thing is abnormal discharge. When your nipple is beginning to, you are not breastfeeding. Now, let me tag that discharge very well because people get confused. If the two nipples, the two breasts are discharging and it's milky, I have nothing to worry about. It's obviously not breast cancer. God is not wicked enough to put cancer in the two breasts. Or even, so if it is both breasts, it's milky. But if it is one breast, it's brown colored. Lord, shout for help. So, unilateral and it's not milky. Once the color changes from what you see when you are breastfeeding a child, shout for help. The 22-year-old nursing student that had breastfeed is dead now. You actually started having frank blood discharge. That was the way she presented. Eventually lost her. And so it was very scary when she came. Unfortunately, she was seeing it and she didn't talk. And she just kept quiet. She was a nursing student. It was very pathetic. There's no how she would not have learned that in nursing school, would not have had that in class. And then she didn't talk to anybody. And then she had it there. And by the time she was eventually going to talk, she was going to have pain. As at then, the thing has gone into her chest. So these things, even if I tell my patient, say, doctor, I just had pain and I came and I said there's nothing. Sorry I disturbed you. I said, no, you didn't disturb me. Oh. Thank God you shouted for help. So that in case we would have found something abnormal. You understand? So please, these are the signs and symptoms that when you see, please shout for help. Next slide. So how do we evaluate the breast? For us, we usually will do a clinical assessment, which is usually done by the surgeons. They will do a clinical breast examination, but you're going to end up with the radiologist eventually. You're going to end up doing an ultrasound or you're doing a mammo depending on your age. Because these tests are also age-specific. If you are under 40, for example, we usually will not send you for a mammogram, except if you have a strong family history. So usually for women less than 40, we'll just take you through an ultrasound and then we'll make up our mind from there. But once you are above 40, you have symptoms, you should screen your breast naturally. The year I was 40, I didn't have a party. I didn't throw a party. In fact, people were disappointed because it fell on a Sunday. So I planned myself Saturday morning. I enter car, came to Lagos. Then he cover me. Because people were waiting for party. Dr. Mijore is 40. And then he go, and he cover me. After church or something, people calling me, Auntie, well, on the way to your house, I said, me, oh, I leko. They thought it was a lie. But one thing I did for myself when I was 40, I went through general checks, and I gave myself a mammogram screening. It would be too bad. I'm a breast radiologist, God forbid. Then I say, hey, my show, and she can take care of patients. And then the same thing happens to you. So I told myself, I didn't throw a party, but I made sure I spent money to run my checks. And that year, I was qualified to have a mammography screening. And so I had one. The one in OAUCHC was not working. I went out to do it. I didn't mind. After I even collected it, I didn't look at it myself because I didn't want to be biased. So I blurred my name out and sent it to all my colleagues. So I let them finish reporting. When they finish, I said, okay, it's my mammo. So they were like, you're not okay. I said, if I tell you that is my mammo, you will be biased from the beginning. So I blurred my name and gave it to all of them. Reports. All of them came out, okay, it's normal. I said, okay, it's my mammo. I made sure I didn't even look at it myself because I didn't want to be biased. So it's important that you have your screening. The other thing is, of course, when there's now a problem, we must do a tissue diagnosis. But I'm going to talk about something. And next slide, please. And that is the cheapest, simplest form of checks that you can give yourself, and that's the self-breast examination. It's not costly. You're doing it yourself in the corners of your room, even on your bed if it is possible. Some people don't even know how to check their breasts. Some people have never even checked their breasts. Am I lying? Some people have never pressed like this to say, keep any me, is there something there? But let me tell you something. If you come to me, I don't know your normal breast. You agree with me that God has made are unique and different from me. But if you check your breast every day, know what your normal breast is. So when your doctor will say, doctor, that thing is not normal. It never used to be there. I've had patients tell me that, doctor, this is not normal. I've never had this in my breast and it's there. So you need to know you're normal. And how do you know you're normal? If you don't check, you just have to check. So I'm going to take like 5 minutes, take you through just a normal check for your breast. Number one, of course, there's no house that doesn't have mirror, except a house that a woman doesn't live in. There's no house that doesn't have mirror. In fact, a standing mirror. You must have. And when you usually stand in front of the mirror, because before you even start to press the breast, you must see there's something different. It's black, red. As the color of the skin of my breast changed. So, you need to know what your breast is normally. It's pointing out. This one is standing straight, and this one is going backward. Once you have looked at your breast, okay, it looks normal. Then you can press. And usually when you want to press,